Hello there. Today we are going to discuss thyroid tumors. I am Dr. Suma. I am a specialist pediatrician currently pursuing postgraduate diploma in endocrinology. I will try to discuss few important facts about swellings or tumors of thyroid. Let me tell you a few words about thyroid gland. It is a butterfly-shaped gland situated in the front of the neck. It produces a hormone called thyroxine. Thyroxine has many important functions in the body. It makes sure that the cells function well. Whenever you hear the term tumor, you get afraid thinking about the cancers. But the term tumor just means swelling. There are two types of swellings. It's a benign swelling, malignant swelling. Tumors are formed when there is formation of extra cells in the body. Benign tumors are usually harmless and they do not invade the surrounding tissues. On the other hand, malignant tumors result from uncontrolled formation of cells in the body and they usually invade the surrounding tissue. They even travel to distant places and spread to the whole of the body. Malignant tumors are dangerous, unlike the benign ones. Next, I would like to discuss the symptoms. In many instances, patients themselves can observe a painless swelling in the front of their neck. The swelling moves up and down when they swallow saliva or water. Swelling moves because it is attached to the thyroid gland, and thyroid gland also moves up and down while the patient swallow saliva or water. Another symptom that might present is a change in voice or there is hoarseness. Sometimes swelling is picked up incidentally. That means a swelling was picked up when they go for other reasons to the clinic. So, what happens in the clinic when we visit the doctor? In the clinic, the doctor takes a detailed history of your symptoms. Then he examines the thyroid gland. The thyroid gland is usually examined from the back. I would also like to discuss the various investigations done in the clinic when you visit with such symptoms. The first test to do is a thyroid function test, which includes the TSH or the thyroid stimulating hormone. If the TSH is low, that means the thyroid gland is working too much and it is unlikely that there is a malignant swelling there. If the TSH is high, that means we have to be more careful as there is more chance that it is a malignant swelling. Another test which helps determine the activity of the thyroid swelling is the thyroid uptake scan. The next test to be planned is an ultrasound of the neck. It helps us to identify the thyroid gland swelling and the details of the swelling. So there are certain features which help us identify between the benign swelling and the malignant swelling. So the ultrasound will give an idea about that. It also helps to identify other swellings like a lymph node of the neck. This also gives an important clue to differentiate between a benign swelling and a malignant swelling. The next step is FNAC or fine needle aspiration cytology. In this procedure, the doctor puts in a needle into the thyroid swelling and aspirates the cells and then puts it on a slide for examination. It actually gives best results, especially when the procedure is guided by ultrasound. The slide is put under the microscope to check the type of the cells. Even though it sounds scary, it's actually a safe test to do and it gives good results as well. I would like to discuss the results. The good news is that majority of thyroid swellings are benign, but sometimes FNAC might not give a definite proof to differentiate between benign and malignant tumors. In that case, we need to depend on the histology after the thyroid gland or swelling has been removed. I would like to give a very brief overview about the types of thyroid cancers. Basically, there are four types of thyroid cancers, that is the papillary, follicular, medullary, and anaplastic. The papillary, follicular, and medullary type of cancers are usually slow growing, unlike the anaplastic. The anaplastic is very aggressive and fast growing. Papillary cancers usually do not spread beyond its capsule, and patients usually they can lead a normal life after the surgery. Follicular cancers can spread beyond its capsule. It can also spread to different areas of the body. One peculiarity about the medullary cancers is that they can secrete various hormones, and they can be part of hormonal syndromes as well. Anaplastic cancers are usually very aggressive and has poor results. Now coming to the treatment. Unfortunately, there are no medications which can treat thyroid cancers. The first choice of treatment is surgery. In most cases, majority of the thyroid gland is removed, or even the whole of the gland is removed. This is followed by a replacement of the thyroid hormone, lifelong. Thank you for watching the video. If you have any comments or any suggestions or any doubts, kindly drop in a message so that I will be able to get a good feedback and I can respond accordingly. Thank you again.